Thank you, everybody, for joining us. Welcome to our April 17th meeting of the Brentwood Rotary Club. I am your humbled host, Sarah Johnson, and I am grateful that you guys are here joining us today. Devin, how many people do we have joining us?
Sarah, we are at 47 right now. So
okay, perfect.
Plus our speaker.
We have 27 plus our speaker, and then we'll have others join us probably
40
throughout the program. With that, I am going to turn over our program to Michael Heineman to lead us in our invocation. Michael?
Gladly. Can you hear me?
We can.
Okay, good. I will have to skip off here shortly. I have another Zoom business meeting in a few minutes, but I'm glad to be on for this part. Please bow your monitors. Dear Lord, we are a people of many faiths, many histories, many backgrounds, and today we are united globally to fight a battle for this world, for this country, for ourselves. We are also united as Rotarians because we are common belief where we are united to support one another around the world. And today we are united as a small group as a community to which we are very, very glad that we belong. Thank you, Lord, for our many blessings, for the health of those that are among us. And we lift up all those who do suffer from health issues, primarily those that are suffering under the COVID virus. Lord, we lift up all these people, and we lift up each and every one of us, and we ask and we give thanks for our many blessings. Amen.
Amen.
Thank you, Michael.
Thank you.
And Michael King is going to lead us in our pledge and four-way test. Michael King.
All righty. Now, I won't ask you all to stand, but if you want to place your hands over your heart, we will begin the Pledge of Allegiance. I pledge allegiance
to the flag
of
the
United States of America and to the republic
for
which
which
it stands, one nation under God,
indivisible,
visible,
with liberty and
liberty
justice
and justice
for all.
For all.
That is not easy to do when you hear 72 people talking at different spots. Okay, now the pledge and the four-way test of the four-way test of the things we think, say, and do. First, is it the truth? Second,
is it fair to all
concerned?
concerned?
Third, will it build goodwill and better friendship? And fourth,
Will it be beneficial to all concerned?
Thank you.
Sir, you have a message.
Sarah's muted.
Yeah,
Sarah, you're muted.
there you go.
Devin muted me, guys. Sorry about that.
How can I mute Sarah?
Many have tried and failed. So with that, I was gonna, Bill McCarthy, we're so glad you're back with us today. And Bill sent me an email about a way to possibly do Happy Bucks. So we're gonna try that today. Bill, do you want me to explain, or would you like to explain your suggestion since you're with us? Can you unmute Bill, Devin?
I gotta find him. Hold on. I got everybody on my screen at once.
Devin, can't they all mute themselves?
They can. Everybody can mute and unmute. Here we
Maybe
go.
they don't know that they can go to the bottom and click on participants and then go to their name and mute.
Perfect. Well, Bill, you look to not be muted. Go for it, Mr. McCarthy.
Go ahead. You got the mic and you can explain it.
Oh, okay. So what Bill was suggesting is that we go ahead and do Happy Bucks, and then what we can do is we have like PayPal, things of that nature, if you want to quote unquote put money in the pot, so to speak, or we could just bill it on an invoice. So if the club is applicable to that, we can. But either way, it's all about sharing the good that's going on in our community. So, and what's going on with us. So I'm going to open the floor up to Happy Bucks. If you could unmute everybody. And I'm going to actually start with one, if that's all right. So I have a client who graciously gave me, because he knew about the Rotary Club, some N95 protective masks that are in their own protection. And they're in this lovely little box. And they're 5-ply foldable face masks. And I have 40 of them. So if anyone needs or would like some for them or their family, please, if you would, send me a separate email after this meeting. And I would be more than happy to drop them off on your doorstep at some point over the next couple of days. And that way, if I want to try to keep our members safe if at all possible. So that was my Happy Buck. So I'm going to put $5 in the pot for that one.
Hey, Sarah, can you hear me?
I can.
Well, if you'll take an IOU, I'll put Happy Bucks in at the appropriate time. And I don't know if Dr. Wang can hear me. Can you hear me, Dr. Wang?
Yes.
Wait, I see him smiling, so maybe he can.
Yes, I can hear you.
Good. I wanted to say again, thank you for being aroused at night years ago by your friend, Dr. Alan Kaiser, and for you coming down and assisting in a surgery that corrected an issue I had with my eye. You helped sew my eyelid back up.
Yes.
I'll be eternally grateful for that. No problem since then. Quite an experience, but whenever I think of you, I always think of you getting out of bed late at night, coming down and assisting on that operation. So thank you very much.
You're welcome. We're a lot younger then.
Yeah, we all were. Thank you.
This is Michael Heineman. I'll jump in with a Happy Buck as well, and I'll just put my money in when we meet again.
Yeah.
First off, I'm thankful for one thing, is that Rob Freeman has never aroused me at night.
Sarah, Dick Bowers. I have 20 Happy Bucks if you can give me 2 masks.
Done.
All right, thank you.
Let me say that we're thankful for a couple of things. Our daughter Michelle in North Carolina was diagnosed with the virus, but she has been quarantined for 3 weeks, never had the respiratory issues, and everything seems well. Our daughter Melissa in New York is facing all sorts of consequences up there, but she personally is fine. But tell you what, New York represents over 50% of the concerns right now in the country. So.
This is Jonathan Merck here. I have a Happy Buck. I'll share. The last meeting we had, I was talking about some of our books that were going to be on national media, and I'm happy to say that one of our books here with Joan London was a New York Times bestseller. So very excited about that, and I think I'll have another one to share next week.
All right, Sarah, I have a Happy Buck. So one of the benefits of this self-quarantine and being at this coronavirus thing is for the past month, I have not had to wear pants, and I'm pretty darn pleased about that.
Well, thanks.
Now, I don't mean that I'm not wearing anything. I just mean I'm not wearing pants.
This is a family program there, Michael.
I got shorts on.
Who else?
I've got a Happy Bucks.
Hey, Charles.
All right. My Happy Bucks is we finally arrived at a time when my use of PayPal for Happy Bucks can be fully appreciated. Once again, I was ahead of my time.
I don't know if anybody else can see on this screen, but we have the illustrious Nick Saban joined us based on his, also known as Burt Bradford. I just found that funny. Who else?
Sarah, I've got a Happy Buck. You may know, many of you may have heard that the city of Brentwood had one employee who tested positive for COVID-19, and that facilitated our largely shutting down City Hall and the rest of our offices and just kind of going to Plan B. The good news is, although that employee did go to the hospital and did spend a little time there, he is now doing much better. He's at home convalescing, and we're blessed to know that he's going to be better, and he's going to join us as soon as all this is over. And we are lucky to have only had the one case.
That's fantastic. That's great news. Who else? Well, all right then, everybody. Wanted to share some thanks to Dr. Wang for joining us. we had some last minute things, and it just happened to work with his schedule, so we're excited about that. And I'm going to turn the program back over to Charles so he can introduce our speaker. Charles? He's on mute, Charles.
Mute. There we go. Is that better?
Yeah.
There. All right. I have two children who are at home with, obviously with school being off the rest of the year. And all of a sudden we've been using Zoom for client meetings for a year or so now. And now everybody's into Zoom. And so naturally my kids are teaching me how to use it. And they pointed out to me that I can set any background I want. So I've decided, because it was the first thing I saw, that I'll be at the Golden Gate Bridge here. So there you go. Hey, it's a distinct pleasure always to get to introduce my good friend, Dr. Ming Wang, who I've known for a very long time and been very pleased to see him speak to our club at least 3 times in the last few years. Most of you know, I think everyone knows Dr. Wang, but I'm gonna read it anyway because it's a good one. Dr. Wang, of course, went to Harvard and MIT. He's one of the few cataract and LASIK surgeons in the world today who holds a doctorate degree in LASIK physics. That would seem to, laser physics rather, that would seem to be useful if you're aiming a laser at people's eyes all the time. Ming grew up in China's Cultural Revolution, in which millions of innocent young people were deported and faced a life sentence of poverty and hard labor. He had to play the Chinese violin erhu and learn to dance in order to escape the labor camp. He eventually made it to America with $50 and went on to graduate with highest honors from Harvard and MIT. He founded the Wang Foundation for Sight Restoration, which to date has helped patients from 40 states and 55 countries with sight restoration surgeries performed free of charge. I'm lucky enough to be on the board of that organization, and it's amazing the stories that have come through. He was named the Kiwanis Nashvilleian of the Year for his lifetime dedication to helping blind orphan children from around the world. He's the co-founder and president of the Tennessee Immigrant and Minority Business Group, co-founder of the Common Ground Network, which is a new nonprofit that focuses on his lifelong mission to help people find common ground and solutions to society's problems. And today he's going to give us the solution to this problem. Thank you very much. It's great to have you, Dr. Ming Wang.
Thank you, Charles. Hello, Brentwood Rotary Club. It's a pleasure to be with you all today. I've been to the club several times, and the most recent was a talk about how to do business in terms of pearls with China, to try to help some of the members of the Brentwood Rotary Club. And I hope today it's one of the best clubs, that Rotary clubs that I've been to. And I think it's probably second largest, second only to downtown Nashville Rotary Club, which I'm a member there. And so I hope today I can add some value to your organization and all the members in terms of some of the key medical information that we like to discuss and to help everyone. The information I'll be presenting today, by the way, I know many of you already and appreciate Charles. Charles Grumman has been the founding member of the Wang Foundation for Sight Restoration for nearly 15 years now. The information I'll be presenting today will come from several sources. One, from my own practice, I'm still taking care of patients with eye problems, including eye infections. Some of the COVID-19 patients have eye infections. Second, I'm in regular contact with several dozen ophthalmologists, physicians worldwide, almost every day. I belong to a big hospital group, which has 400 some locations in China, 85 in Europe, many in Italy and Spain. and Southeast Asia 11, 7 in Hong Kong, which second wave is coming back there. South Korea and Japan, many of my colleagues. So my information will come from a worldwide sources from physician friends. So these are on the front line, deep in the trenches, what's going on in these other countries, which many of them are 2 months ahead of us. So what they're doing is what we will be doing here in about 2 months. Also, my information comes from extensive read and communication with several researchers involved in the front line of vaccine development and treatment development as well, almost every day. And finally, from WHO and CDC guidelines. So most of the things I'll be talking about today are not speculations, but based on information I got directly from physicians that are involved in these other countries and government recommendation and research, latest research information. You know, right now there's so much information out there, but it is too voluminous and sometimes very confusing, as you know. So it is very difficult for us as average citizens today to really know what is the truth without bias and what are the key essential medical information that all of us need to know to protect ourselves and families. So that's where I come in. I've been serving as this bridge, somewhere in the middle, to distill, extract, summarize, and communicate to all of you, all of us as average citizens, in terms of what are the most important key medical information, free of bias, and what we should do to protect ourselves and our families. Before I begin, I want to make sure that my outreach coordinator, Alana, probably is on the webinar as well. Hopefully Alana is. Alana, if you are, can you say hi?
Hi, I'm
Okay.
on. Thank you
Good.
guys so much for having us.
Great. Thank you, Alana, for helping arranging this. Later on, we'll bring out Alana again if anyone need to contact me afterwards. Today, I'd like to divide this session into 2 parts. One is presentation, some of the key facts. Second is open up for question and answer to all of you. So first part, the question and the presentations. I'd like to present 12 important topics. First, where are we as a nation? And how about the rest of the world? Second, why this virus is so deadly? Number 3, why this virus has killed so many young people? Number 4, what are the 2 principal means of transmissions by COVID-19? Next, what are the 3 principal portals through which the virus gets into our system? There is a way to 100% to protect ourselves because this virus does not penetrate our skin if we guard these 3 portals. Next question is, what country has done the best? Why? Next question is, what country has done the worst? Why? Next question is the benefit of staying home, because there are some debate right now in terms of the benefit to loss ratio of staying home. And next question is, what are the 3 hotspots all of us should be watching out right now, the moment you go out? Cash, cell phones, and gas pump handles. Next question is, what are 2 most important things we should be doing now? And last question is, we as a nation, we're about to open the floodgate in May. We as a nation got burned so badly the first time around. In late February, early March, even though President Trump has shut off the air flight traffic from China, which was the right thing to do. However, when the virus did hit us late February, early March, agencies such as CDC was not even ready with testing kits. So that resulted in the midst of the critical first few weeks in identification of the first group of patients in the United States who got infected. That contributed to our nation now being the most infected nation in this world with the most number of deaths. We got burned the first time around, early March. We as a nation, now there's another chance, another critical moment has come when our nation will be reopened. We cannot afford to get burned again by being ill prepared again. So I'd like to talk about the 7 key measures that will help America avoid a second outbreak when we reopen in May. So starting these questions. First, where are we as a nation? How about the rest of the world? China is coming off the peak. Italy has passed the peak. United States is peaking right now, mid-April. But there are 2 kinds of peaks: new case peak and death peak. Because the typical course of infection is first week, no symptom. Second week, we have symptoms. 98% of us are fine after that. 2 to 3% will go on to continue to have disease at third week, get hospitalized. Fourth week, 80% of those on ventilator die. 80%. That's a typical course, 4 weeks course. And so the death is delayed by the new case peak by about 2 to 3 weeks. So we are peaking as a nation in the United States mid-April in terms of new cases, but the death will continue to rise after mid-April until it peaks in at the end of April. So there are 2 kinds of peaks. Next question is, why virus so deadly? Because most viruses we've known from virology in medicine are either very infectious but not very deadly, such as common flu virus, or very deadly but not very infectious, such as the SARS virus. But COVID-19 has managed to possess both. Very, very, very infectious, but also quite deadly. It's not as deadly as SARS, but still quite deadly up there. That's why it's so deadly, this virus. Number 3, why some young people are dying. Of course, the hotspot is still elderly and medically sick. 80% of those who died are over age 55. But still 20% is under 55. Why? That is because from medically speaking, it's the concept called viral load. That's the number of viruses that got into your system to begin with in the initial infection. If the number of viruses getting into your system is very small in number, the viral load is very small, then since the virus takes many days to replicate, you're fine in the first few days. And your immune system has the time to gradually ramp up the production of antibodies. Until second week, the antibodies got enough, start combating the viruses. That's why you have symptoms: fever, dry cough, malaise, and taste change. And then most of us, the immune system succeeded. We're fine the third week. However, in minority of us, we unfortunately have repeated exposure and close proximities, such as healthcare workers, nurses, policemen, paramedics, supermarket attendants, and nursing home, staff. The number of viruses getting into the system to begin with is very large viral load. When the virus getting into the system is so much to begin with, it doesn't take very long to replicate enough to overwhelm your system. And your immune system has been faithfully working hard for you for the rest of for entire part of your life. So your immune system is not going to readily admit defeat this time. It's going to do everything possible to keep you alive. So what immune system does when such a large amount of virus gets in the system so quickly, is to ramp up the immune response ASAP with the highest level in a short period of time. Such an immune over-response is what we call cytokine storm, C-Y-T-O-K-I-N-E. So in those young patients, due to high viral load, close proximity, repeat exposures, result in immune overreaction. And in these young people, it is the immune overreaction, not the virus that kills these young people. So in these young people, the immune system, strong, healthy body actually goes against them. Number 3, what are the 2 means of transmissions? COVID-19 is very, very, very smart. It figured out 2 ways to most effectively infect human race. That's why it is the most infectious virus that we have ever encountered in medicine. Number 1, it finds a very friendly, effective traveling companion in bacteria. So when you go out today, out there in the public, any surface you think is not sterile, has bacteria, at the height of outbreak, you have to assume it has COVID-19 until proven otherwise. Second, COVID-19 also found a very unique way, which we have never seen that in virus in the history, being able to suspend itself in the aerosol, not air molecule, but aerosol, slightly larger than air molecules, little sphere of fluid. You can't see it with naked eyes. To give you a sense what aerosol is, A-E-R-O-S-O-L, is if somebody bring a bag of popcorn into your office and finish the popcorn, then leave your office, no popcorn left in your office, you will still smell popcorn for the next 2 hours in your office. Why? Because popcorn pieces are suspended in the aerosol inside your office. That's why you can still smell it, even you can't see it. COVID-19 found a unique, unprecedented ability to suspend itself in the aerosol. So that means at the church, some of these 3 rows in front of you, sneezes or cough. Then the virus will get into the aerosol in that space in the next 8 hours. If you walk into that space previously occupied by this person who sneezes, COVID-19 plus, in the last 8 hours, you could inhale the viral particle, still suspended in the aerosol. That's why one of the earliest outbreaks in South Korea occurred in a church with 20,000 people, one single service, 2 hours, come back out, large number got infected. Transmit through air by aerosol. Next question is, what are the 3 principal portals? You know, when you go out today, you're going to touch a bunch of things, grocery stores. Since this virus travel with bacteria, co-traveler, you have to assume your fingertip has the virus. But you're not infected because the virus does not go through your skin. And as long as you don't touch your fingertip to the eye, the nose, and the mouth, you're 100% protected. Speaking of eyes, next question is, what are the eye infections? Is contact lens wear still safe? The eye infection with COVID-19 we are taking care of right now are conjunctivitis. American Academy of Ophthalmology just come out with a recommendation that as long as COVID-19 is with us, contact lens is no longer as safe as before. Because as I said, you have to assume your fingertip has the virus. When you put in the contacts, you're putting the virus into your eyes. One of the 3 portals of entry for COVID-19. In fact, at One Vision Institute, we are still open right now, conducting online LASIK evaluation and cataract surgery evaluation every day. One of the most common questions asked to us right now is, I wear glasses, contacts, what should I do? Dr. Wang, how long will the COVID-19 be around us? What should I do? Well, the virus will be with us at least for many years, if not for the rest of our lives. The earliest time vaccine will become available is 2021. if it becomes available. I will discuss in the question and answer why this virus is unique, challenging to create vaccine for it due to hyper mutation that we have already seen. ABC3 major form already, COVID-19. So contact lens is not as safe, glass is fine. But for those of us who are fortunate enough to be able to be medically qualified for LASIK or laser cataract surgery, or for avian lens surgery to get rid of your reading glasses, then certainly that's a good option now. Next question is, what country has done the best? What country has done the worst? Why? South Korea, best. Why? In the early phase of this crisis outbreak, South Korean leaders quickly overcame their differences, found a common ground, and come up with consensus and with uniform recommendation to its population, effectively control the outbreak. What country had done the worst? Italy, now United States. Particularly Italy, in the first few weeks, the leaders could not come into consensus. They remained in a polarized state, could not overcome their differences to find a common ground. So for many critical weeks, Italian restaurants were still open, public transit was still open. Here I'd like to mention briefly about common ground. It's my lifelong passion to help people find a common ground. We have a nonprofit, Common Ground Network. You know, today our world is so polarized. The social atmosphere is often toxic. People don't care about the merit of issues, only power alliances. These days, civil discourse without insulting your opponent is becoming increasingly rare. You know, for me, as Charles introduced early, I came from China, suffered through Cultural Revolution. I came to this country as a poor student many years ago with only $50. One of the things that attract me the most about America, that's why this country is a magnet for all the immigrants from around the world, is the saying when I heard very soon after I landed in America was, I may not agree with what you say, but I will defend to my death your right to say it. But I feel as a nation, we are departing from that. We're increasingly become more fixated on our differences rather than appreciating what we have in common. So now the wake-up call has come. The virus woke us up. We find ourselves, we're not in a habit or used to be able to overcome our polarization, overcome our differences quickly, and find a common ground. So I think being able to find the common ground, overcome our polarization is so important to our society in general to resolve the differences that we have in the society, generally speaking, healthcare, jobs, economy, but also when a crisis comes, we have to be prepared. In this viral crisis, we have found the common ground, indeed. And that is, we as human beings, we're all so vulnerable. We have no other choice but to find a way to work together. So that's the problem with Italy, and in many ways, United States. Next question is, what are the principal three keys in terms of protecting ourselves? Cash, cell phone, and gas pump handles. Cash is very dirty. In this outbreak, the height of outbreak, you have to assume when you get a cash from someone, it has the virus because it has the bacteria, and the virus travel with bacteria. So what you do, you put the cash in your wallet. If you have a sink nearby, of course, wash your sink 20 seconds with warm water soap. If you don't have sink, it's okay. Just remember your fingertip is dirty. It probably has the virus right now. Don't touch the three portals, and wash your hand when you get a chance later. The virus on your skin, fingertip, does not represent you're infected at all. Cell phones. One of the common mistakes, I do this webinar all the time on a regular basis, several a day right now, across the country. I just did 2 in Oregon, on the West Coast, for example, several hundred people. One of the most common questions asked to me now is, Dr. Wang, you know, I wash my hands all the time. But I say, wiping your cell phones, because we touch our cell phone several hundred times a day. No, now you have clean hand, touch your dirty cell phone, your hand is dirty again. So what should we do? At the height of outbreak right now, carry a stack of little alcohol pad in your pocket, wipe your cell phone many times throughout the day. Number 3, if COVID-19 were to ask me, Dr. Wang, I want the most effective infection of human race. Where should I infect? The answer is gas pump handles. Because I touch my cell phone, you touch yours, but I don't touch your cell phone. But what we all touch, gas pump handles. So what I recommend is bring a roll of paper towel in your car. Every time you step out to fill gas, tear one piece, wrap around the gas pump handles and throw that paper towel away afterwards. Hot water is good. The virus is afraid of hot temperature and the light. Drink hot water. Wash your hand with soap 20 seconds with hot water. In 1918 Spanish flu, the only effective way that people had was move the hospital bed all in the sun bathing. Now I'd like to talk about the question that the most important thing we need to do. Stay home right now and wear masks. There are 2 benefits of wearing masks. Small benefit is to block the direct sneeze and cough, but the aerosol still sneak around the mask. So it's only partial protection. But the main benefit of wearing masks is something that most of us don't appreciate. People think wearing masks is protect myself against others if others are infected, or protect others against myself if I'm infected. But the main benefit of mask wearing is actually neither. The main benefit of the mask wearing is protect yourself against yourself. Because when you're out today, without realizing, as I said, your fingertips almost for sure has the virus, a very high likelihood, until proven otherwise, since it's co-travel with bacteria. Then you're going to touch your face without realizing several hundred times a day. The main benefit of wearing a mask is to protect yourself against yourself. Final question, then I'll open up for question and answers. That is, as I mentioned, we got burned badly as a nation in early March. Even though President Trump closed the in-flight from China, which was the right thing to do, but many agencies, governments such as CDC were not ready. CDC did not even have the kit ready in early March. So missed the critical first few weeks to identify the earliest group of patients infected here in America. These contribute to our country being the most infected nation in the world with the large number of deaths. Now, ladies and gentlemen, my fellow Rotarians, there's another critical moment has come. We're about to open our nation. We may risk a second and even more deadly second wave. 60 million, 60, died in 1918 Spanish flu. 1 in every 4 people on this planet. Majority of death occurred in the second and third wave, a lot more than the first wave. 500,000 Americans are identified COVID positive right now, over 600,000. And however, 5 to 10 times that number are silent carriers. Then you may say, Dr. Wang, how do we know that? We just had a controlled scientific experiment just completed on Theodore Roosevelt aircraft carriers. Out of 5,000 Navy soldiers on aircraft carriers, pilots, 600 were tested, and they found that majority never had symptoms, never had symptoms. So the number of silent carriers is several times, based on this experiment, more than the symptomatic ones. So up to 2.5 to 5 million Americans today are silent carriers. So here's the thing. All of these silent carriers are staying at home right now. But when we open the floodgate in May, reopen our nation, the 5 million silent carriers will be released from their home confinement back out in the open society, potentially infecting everyone, result in a second and potentially more deadly second wave. The second wave is already being seen in many countries which are 2 months ahead of us. Hong Kong, Japan, and many other Asian countries. Now, as a nation, America has a great opportunity to learn from these nations what is now working in preventing the second outbreak. We have to be prepared right now in April to implement some of the essential measures. I'm going to outline 7, so that when we reopen our nation in May, we can immediately implement. We cannot afford to be burned again by being ill-prepared again. So that preparation has to come in April. The following 7 measures did not come from thin air or my imagination. It came from my actual information from doctors involving front line of care in China, Japan, South Korea, Hong Kong, Italy, and Spain. I have several hundred colleagues. I'm in regular communication every day. Number 1, when we reopen, it has to be gradual, steady, slow, high priority essential businesses first, and anybody entering this business should all have temperature check. Number 2, in those early to open businesses, every one of these businesses should be tested. Number 3, people who are already immune to the virus should come back to work first. It has 2 groups. One is people who suffer from COVID-19 and have healed. But just because you heal doesn't mean that you are not shedding your viral particles. You are still continue shedding your viral particles for 3 to 4 weeks. So repeat the testing until 3 to 4 weeks later, you're no longer shedding viral particles and you can come back to work first. Second group is large number of asymptomatic carriers. And some of these have antibodies. Some of these are no longer have the virus, but have the antibodies. Number 4, voluntary testing. Voluntary. I advocate just like voluntary voting. Anybody who get tested, you can wear a little sticker, like I was tested, like I voted, but voluntary. Number 5, required testing for high-risk facilities and high-risk professionals. Nursing homes, hospitals, clinics, and also high-risk and prisons, and high-risk professionals, doctors, nurses, paramedics, policemen, supermarket attendees, restaurant servers. Required testing. Number 6, continued social distancing, wearing masks, and avoid crowded places with lots of people, enclosed. Number 7 of my 7 essential measures to prevent the second outbreak here in America when we reopen in May is using digital contact tracing technologies. Google and Apple have just decided to overcome their differences, found a common ground to work together to devise the cell phone-based technology. But as a free democratic society here, we also must protect privacy and individual rights of our citizens. So in summary, we got burned badly as a nation, first time around. The second time, another critical moment has upon us. When we reopen our nation, we cannot be burned again by being ill-prepared in April, before the reopening, again. So we need to implement these measures, such as our outline 7 key measures learned from countries that are battling second outbreak as we speak. what works, those are what's working. And we should really truly be prepared so that we can, when we open the floodgate in May, in our nation, we don't bring on a second and potentially more deadly outbreak. I'd like to, Alana, could you chime in just very briefly before I open up for question and answer, that if any of them have any question, I think the organizer, the Rotary Club, that they should be able to type in question in the chat box here, or verbally ask their question, unmute yourself. And also, if your church, Chamber of Commerce are interested, I'm doing this throughout the whole United States, several, 3, 4, 5 a day, and no charge. It's my public service to the community because I'm in a unique position knowing what's going on in the rest of the world. And also, I'm involved frontline taking a patient. I'm a physician with this information. So I have a unique duty, opportunity to communicate to the public. More of us know about that, these 7 measures, more chance we can communicate to our legislators and leaders to listen to these, what works. Not that every part can be implemented in America, but at least be prepared as much as can. Alana, can you just mention briefly if anyone knowing their church organization can, how can they contact with you to arrange more webinars like this after today?
Hi, everyone. Thanks so much again for having us. We hope that you enjoyed Dr. Wang's COVID-19 presentation. So he's currently right now giving these COVID-19 updates free of charge for any organization, any club, Rotary, Chamber of Commerce, churches. And this is really our way of being able to provide something to the public as a service so that we can help spread the word about COVID-19 and how you can help prevent spreading it. And so what I'm going to do is I'm going to leave my email and cell phone in the chat box. And if you would like to set up something with Dr. Wang for him to speak at your organization or church or Rotary or club or even business, we've done a lot of businesses. He's getting booked pretty quickly. We actually have over 20 on the list right now, so I want to make sure that you get your first pick. So I'm leaving my email and cell phone, and feel free to reach out to me, and I'd be happy to get you on his calendar as quickly as I can.
Thank you. Questions?
Dr. Wang, I'm going to read a few from the chat window.
Okay.
The first one I see, Della Welling asked, are UV wands effective, used to kill the virus?
Partially. UV light has been shown, but UV light has UVA, UVB, UVC. UVC has the shortest wavelength, and UVC has shown about 30% to 50% virus killing over a certain critical period of time. But most of the time, the UV light we have in contact, like UV lamp, are UVA, the longer wavelength, because UVC is potentially harmful to our skin. So we're not using commonly, but in medical setting, UVC is. So UVC works partially for minimal period of time, which is several hours typically.
Jonathan Merck asked, do you have a specific clarification of once you've had COVID-19, can you catch it a second time?
Great question. At the moment, 99.9% of patients who have healed from COVID-19 on worldwide scale have not shown second infection. Even we don't know if it's for sure, but looks like with 99+% confidence that from this first wave, most of us don't. There are a few reported cases of second infection, but it has been proven medically by doctors. These are reactivation of existing virus, meaning the virus was not completely gone in these few individuals. Because it's a bell-shaped curve, not everybody virus is completely gone. Second related question to this is how long most of us who are infected, that healed, the immunity will last. Most likely, based on experience of virology, last about a year or so, that's it. That's why every fall we have to get a flu shot to combat the flu in the winter because virus like cold, as I said. That's why we have to get a shot every year. In fact, our regular flu shot in regular times in the past, 20% of the flu shot, the component of the reagent in that tube is actually coronavirus, not COVID-19, but different strains of coronavirus.
Hunter McCarty asked, do you believe that the Chinese government was truthful in terms of when they say they first saw evidence of COVID-19?
No, there are all evidence pointing that they tried to cover up for several weeks and was very reluctant to share the information. That brings up another point that is important right now between countries. In my belief, we need to get as much information scientifically. These, some of the earliest cases, the patient 0 is the most benefit to human race because that is the unmutated COVID-19, the original form, first cross from bat to human, that patient 0. That's obviously in Wuhan. So I think we need to work with Chinese government. Let's put aside our difference momentarily. Can we cooperate, at least scientifically? Because exchange those informations right now. I know that they did cover up, there's no question about it. But my suggestion is for the benefit of all, let's try to collaborate at least scientifically so we can get these earliest data to develop the most effective vaccine. Because this virus has mutated already 3 major times in the past 3 months, A, B, C. And the B form is most lethal. That's the form infecting Italy and United States. The more mutation it has, the harder to develop the vaccine. Because in vaccine development, you take the virus, chop off the part that will kill, keep the part which will arouse immune reaction, and then inject that truncated, weakened virus into you to generate antibodies from you. So more mutations, the harder to develop the vaccine. That's why vaccine may not be able to develop. In human history, some of the things we have never developed vaccine. Some will take several decades. Some are taking as quick as 1 year. At the earliest 2021, if we were successful.
Hey, Devin, before you go to the next question, part of Hunter's question, was there any uniqueness about the virus beginning in China? Is there anything that happened there that caused it to start there?
Yes, because in Wuhan, there was this raw meat market. People eat raw animal meat. COVID-19 has been known to infect other animals prior to human race, including bat. That's the main host for COVID-19. But all these years, the virus never mutated enough to infect humans. But in late November, early December, one single virus mutated, got lucky. They infect patient 0 in Wuhan raw meat market. So Chinese government has closed the raw meat market there, and I hope it will never open again.
Sarah Johnson asked, because it's still difficult to find masks to some degree, is there a way to properly sanitize or clean them for reuse?
Good question. There are 2 kinds of masks, N95 versus regular masks. N95, most of us don't need to wear unless you're in the hospital. Like me, I work in close proximity with patient, exam patient in the eye, very close. We have had to shield, have to wear these masks. Because I deal with elderly population with, cataract surgery and other medically sick. But most of us who are not involved in healthcare, you don't need to wear N95, just regular mask. Because the mask's main benefit is to protect yourself against yourself. So you don't touch your dirty fingers to your face throughout the day while you're out. So any barrier, CDC recommendations, any barrier will be fine. You can take a handkerchief or scarf, just wrap around. Most masks can be reclaimed, no problem. You go home, you take alcohol pad or alcohol spray or hot towel with hot water with soap, wipe, and then hot water, rinse, hang air dry. Next day you can use it for most of the masks.
One other question we had, one of Tish's children, our child, one of our kids, has just gotten over what looked to be a mild case. How long before it would be safe to be with them?
As I mentioned, it's about 6 weeks course. First week, we have no symptoms because immune system is ramping up. And second week, we have symptoms, immune systems and virus are fighting, big war right there. So all of us, have some symptoms. 98% of us are fine. 2% of us go on to continue to have disease, and third week got hospitalized, and fourth week, 80% of those on the has the virus, go on the ventilator, die. So that's 4 weeks right there. After that, there's another 2 to 4. I would say total can be as long as 8 weeks. After you heal, there's another 3 to 4 weeks you're shedding viral particles. So have to be confirmed by repeated tests until about 4th week after you heal to not be shedding virus and then no longer be infected. Of course, you still have antibodies. That's why you are immune for 1 year. So therefore, for 98% of us, 1 week healthy, 1 week symptomatic, and 4 weeks of shedding, 6 weeks. For people who, who are going to go on ventilator, of course, it's going to be longer, extra 2 weeks if they survive ventilators.
Looks like we have another question. What is good to use to clean our cell phones?
Clean our
cell phones.
Cell phones, yes. Stack of an alcohol pad in your pocket, and throughout the day, whenever you think about it, just wipe the back of the cell phone and keypads, throw the alcohol pad away. So that's what we do now. Now, do we have to do it forever? Hopefully not. At the height of peak right now, the density of virus in the air is very high. The density on the surfaces, especially dark, damp, wet, cold surfaces, has viruses right now. You have to assume that when you go out until proven otherwise. So when the peak subsides down, our life is completely different. Shaking hands and hugging may become the things of past. We're going to gradually reopen the nation following these 7 measures that, as I said, proven measures to work in these other countries, which are 2 months ahead of us, and they are battling right now for the second wave, which we will be battling that in May and June. So implement these 7 measures is critical. We need to communicate to as many people as you can so that hopefully we will do it ourselves and let our leaders know that that's the things we need to do as a nation to learn from the rest of the world.
Well, I'm going to interrupt Devin and say, well, thank you, Dr. Wang, so much for speaking with us today. It was very informal and in our settings, but it was very informational. And I think we've all taken some information that we can definitely pass on to those we know, as well as implement in our own lives. With everyone else, I will email out Alana's information to the group, as well as we are recording this session with Dr. Wang. So that will be on our Facebook pages. We'll also put it out in LinkedIn as well as Instagram, if we can get all that working. And I'm pretty sure some of our Rotarians will get it on Twitter. I'm just not a Twitter kind of person. So with that, if there's nothing else for the good of Rotary, we are adjourned, everyone.
Thank you.
Thank you.
Thank you, Dr. Wang.
Thank you.
Thanks, Devin.